The most reliable marker is abdominal circumference for assessment of the fetal weight. 30 में कम से कम 25 correct करना है doctor, gynops में, this time. Then basically it is the 6 and 11 which are considered to be low oncogenic potential. Androgenic insensitivity syndrome, without that where is the question paper? One more twin sister of this is missing. Mullerian anomalies. One more twin sister is missing, congenital adrenal hyperplasia. One more is missing, multiple endocrine neoplasia. One more is missing, polyglandular autoimmune disorder. A five sisters hai, 5 sisters, only one of them has come in the exam. Then cone biopsy. So if it is CIN 2 and 3, or if there is an unsatisfactory colposcopy, if there is a micro invasion, they are all the important indications. Pelvic inflammatory disease can lead to chronic pelvic pain, ectopic pregnancy, tubal infertility, etc. etc. Hysterosalpingography mein what you cannot diagnose? Endometriosis. Here we gave by mistake a wrong typographic error. But about uterine anomalies there is a small point that you can contest. Hysterosalpingography cannot look at the external contours of the uterus. So if you want to distinguish bicarbonate and separate uterus, it is difficult. But that is a small anomaly. Right answer would be endometriosis only. So what are all the things inserting onto the perineal body, doctor? External sphincter, superficial and deep transverse perineae, antrofibers of levatrinae, etc. etc. If you are managing cryptomenorrhea, will you dilate cervix or vagina? Cervical dilatation is practiced, not vaginal dilatation, is what you will do, is what need to be remembered. You will do cruciate incision, you will do excision, you will do drainage, etc. etc. Ectopic pregnancy medical management करने के लिए shock में कैसे भी नहीं करते, unilateral pathologies में more likely to be used. So B should be answered. Here there is a small mistake. It's not just in our key. Yeah. Then tranexamic acid is the non-hormonal treatment. Is a very well-known fact. This is our favorite question. Placental site trophoblastic tumor. Many times we discussed. What was your answer? It is basically chemoresistant in nature. Surgery, hysterectomy is the one that you need to basically do, is its specialty. इतना प्रिपेयर होके कॉन्ट्रसेप्शन के ऊपर गए तो एग्जामिनर ultimately asks, will condom break or it will not break? So others won't break. Even if they are broken, you can identify where they are. Best method to know the copper T in the uterus is? Examiner's answer was ultrasound. That's right. Anybody answered plain X-ray? Innocent answer. No? Very good. Then about laparoscopic sterilization. Answer given was? I too thought it as C. I too thought it as C. Mini laparotomy is done within 2 days of delivery.
Sir, but it's not that it has to be done. It must be done.
Must be done makes it.
That's why I put it.
This must be a strong thing to propose A as the correct answer. But do you do it under local anesthesia? No.
Sir, for laparoscopy, you just have to give us one X-ray.
I think this maybe examiner also can be right from that perspective. Agreeable. So out of 125 questions, doctor, do you disagree anything or rightly classified? Now we will go into the real fight. Okay, doctor. Now, shall we talk about the controversial 3 MCQs? Let's see, controversial 3 MCQs where multiple answers are possible. Cordner's phenomena. Except what was the examiner's answer? Come on, doctor. You go to Wikipedia. Psoriasis, pityriasis, SLE, necrobiasis, lipoidica. विकीपीडिया में आप जाके कॉर्नर फिनोमेना एक बार ओपन करो, उसमें एसएलई भी इंक्लूड किया. So it can entertain multiple answers. If you have gone wrong, you go and fight. If you are right, forget about it. Don't fight. Then sudden diminution. You all thought vitreous hemorrhage.
But it's total blindness. It's not diminished.
That's right. I'll come to the point. I prepared very well for the court of law today. Sudden painless diminution of vision. You have vascular occlusions, central serous retinopathy, vitreous hemorrhage. Sudden painful diminution. You have iridocyclitis and acute angle closure glaucoma. So both of them are responsible. So this, if you have gone wrong, you can contest, but nobody will go wrong in this question. You marked C? Oh good, then you can always contest. Yeah, you can contest this because you have got a reference where both of them are marked under painless diminution. Then HCG produced by placenta. What was the answer given by examiner? C. D examiner gave. Possible. No. Examiner might have given D. Examiner can be right. Why right? Because it has thyrotropic activity, but a mild thyrotropic activity may not be significant enough to stimulate the fetal thyroid tissue. It has a weak thyrotropic activity which may not be sufficient to stimulate the fetal thyroid tissue. So that way, ये तो पक्का है. HCG has immunosuppressive activity which
Because we knew that it is LH and TSH similarly, so we knew that C and D were right, and we knew that B is right. So that's why we put it.
But D is possibly correct according to examiner, and it may be a right answer because it stimulates, it may not stimulate sufficient enough to stimulate the fetal thyroid activity. So that's what we need to agree. I think this is not a controversial then, but this is intellectually easy to lose kind of a question. So there are the 3 important questions I would like to call possibly controversial but not really so. Okay doctor, shall we go to talent program where you are guessing talent, everything is all that you need to have in order to win these questions. That's right. 50 questions में ये साबित हो जाएगा कि आप कितने पढ़ के गए. I mean, really, what was your background knowledge? It has nothing to do with your previous questions or what you read. Exam hall में could you apply the mind or not? Nerve to masseter. After supplying masseter, will it go to heaven? Will it go to eat biryani in Hyderabad house? Where will it go to? Who will know? Temporomandibular joint. Ammon's heart. Limbic system. Limbic system is highest topic in physiology. अगर वो नहीं है तो यहाँ है तो वही आंसर है. Then sacred tuberous ligament. Examiner gave biceps only. That's right. Basically, the lower border of the sacred tuberous ligament is in continuity with the long head of the biceps. So that makes it as the answer. Inferior tibio. Many times we discussed this in our mock test and reminded you one question on syndesmosis, type of cartilage, type of joint. Definitely आएगा. Inferior tibiofibular. This is another endocochlear potential wala question. Purely your common sense in exam. What is the speciality, doctor, of if you look at all the endolymph, it is a unique ECF. Generally ECF में sodium ज़्यादा रहता, potassium कम रहता. Endolymph is the only extracellular fluid which has a high potassium concentration, is what need to be remembered. By the way, what was the examiner's answer? C. He gave C.
Sir, but actually I had a doubt when I was answering this. Once the footplate strikes the
Online students are not knowing what you are saying. Yeah.
once the footplate strikes the endolymph, the lymph will move, and then it'll organ of Corti will move, and then the hair cells will move, and that will lead to generation of potential, right? So
Correct.
indirectly, it has to be produced because of sound.
That's right. It has to be produced because of the sound. There is no doubt. Sound evoked mechanical stimuli permit endolymphatic potassium to.
But then, sir, fourth option.
What happened to that mic? Voice is not coming. Another mic it will come. Just take the, because it is the hour for discussion. Yeah. Check. Yeah.
And then the fourth option said it is required for excitability. But then after it gets excited, then only endo potential will get developed. It is not actually required for excitability, right?
No, it is required for excitability. I leave the explanation for you. Transduction is sensitized by the endocochlear potential of 80 millivolts in endolymph, which is relative compared to that of the perilymph.
Yes.
So it is definitely required for the excitability of the cochlear. It is not the one which is generated as a consequence of the cochlear hair cells activity. See, endocochlear potential, doctor, what is the main meaning of it? Perilymph mein there is some voltage. Endolymph mein there is some voltage. The voltage difference between the two is the one which is deciding the endocochlear potential. So, examiner has given C, you mean to say, but it is auditory stimuli evoked only, in response to that only. But it is around 80 millivolts positive to perilymph is something that I wanted to contest. Endocochlear potential is positive voltage of 80 to 100 millivolts in the endolymphatic spaces. What was given in the option A? It is given in perilymph. That makes it unlikely. Perilymph may, it will be minus 70, endolymph may 80. So that is relatively 150 plus it should be. So that is the reason option A in my opinion, but we need to ask that physiology great teacher who composed the question. Right, then. Best method for sera sterilization. What was the wrong answer? You have marked. Is the right answer. Filtration classically. Right? Filtration is what need to be remembered. Then hematopoietic stem cell. Did examiner give option D? Stem cells resemble which cell? Lymphocyte or blast? They resemble lymphocyte is what need to be remembered, but not lymphoblast. Once more, ये पढ़ने की वजह से प्रिपेयर होके एग्जाम गए तो नहीं होता. Situationally you should guess. To be more precise, we have to classify it under the luck factor based questions rather than talent or guess based. Hepatitis A. What is the examiner's answer? Propagated. Key is propagated. Okay, that's what I am saying. The propagated key has propagated answer. Okay. But what is the it should be, otherwise what should be the Bhopal gas tragedy? Single exposure epidemic, point source epidemic it is called as. Bhopal gas tragedy, hepatitis A common source outbreak. Outbreak is the one which makes a group of people all exposed to any infectious agent or toxin same source. So, the epidemic of leukemia in Hiroshima, epidemic of hepatitis A in a restaurant, each had a point source of exposure. So, that is the reason correct answer should be common source, single exposure.
Yes.
Highly polluted water,
See.
superchlorination followed by dechlorination. Talent wala question. Bimodality is not a feature of purely